Hi, this is your teaching video for your ablative laser. That's any laser you would have in the operating room or a profractional, micro laser peel, or resurfacing here in the office. So first of all, hopefully you're already on your skin prep. That includes either Obagi Blender or Clear, which is hydroquinone. If you can't use hydroquinone, our White Lightning will also work as a botanical skin brightener. Also, we hope you've already started on a retinoid to help stimulate more collagen. And basically, it's like priming the walls, getting you ready for your laser. In the 2 weeks before your laser, be sure to avoid sun, and hopefully if you're coming to this practice, you're already on religious sun protection every day. Now, we will give you a hydrating serum at your pre-op appointment. And what this is it's a hyaluronic acid that sucks water into your skin and holds it there. That's the way you hydrate your skin. I use this big size twice a day, and it's part of my regular skincare regime. What the lasers are doing when we're rejuvenating your skin is they're looking for and are attracted to water. So the more hydrated your skin is before this procedure and at the time of this procedure, the more effective it's going to be. So on the day of your procedure, after you've showered and cleaned, this is the only thing I want you to have on your skin. As I said before, this can be part of your regular skincare long term, and I highly recommend it. Now, when you wake up from your laser, likely we would have used platelet-rich plasma to apply topically before a thick coat of Aquaphor. When you're home, you're going to be reapplying this Aquaphor round the clock so that your skin doesn't dry out. We also recommend that you use cold compresses. So gauzes, make a bowl of ice water, put a little splash of vinegar in it, throw a couple of gauzes in there, and you can lay those on your freshly lasered skin. They're going to do a couple of things. It's going to cool, and it's also going to clean. You can even take a few washcloths, put those in the ice water bath, and apply them on top of the gauze so that you can keep reapplying cold and moisture, which are really good for your comfort and also for healing. That way you can keep reapplying the washcloths and not have to peel the gauzes off as frequently. After your first shower, we want you to apply this Omni Core Recovery Complex. What this is just growth factors from a newborn. If we didn't do this for you in the office, take this little valve out like this, because otherwise you can't pour or get to this stuff. So you take the valve out, and we like to include a syringe so you can dip it in there and pull this out. Now, these growth factors should go on clean skin, and there's usually enough in here for 2 showers. So when you get out of the shower and your skin is clean, you can suck up about half the bottle, which is 2 of these syringes, 2 cc's. Apply it everywhere. It'll sting for a couple of minutes, and then go ahead and reapply your Aquaphor. Like I said, that will last you about 2 showers. Now, this Elta MD moisturizer is kind of like Aquaphor Light, and you may like this. Everybody's laser is really to a different depth, and everybody's skin is going to heal a little differently. So you can always try this. Like I said, it's lighter and much less greasy, and if it's keeping you moist long enough throughout the day, reapplying it probably 4 to 6 times throughout the day, you can use either or, the Aquaphor or the moisturizer. Dermal wound cleanser is a lot like wound Windex. If you've got like a lot of schmutz, and typically with a heavy laser, people are gonna look their worst at about 3 days. You're gonna start off looking like raspberry jelly all over your face when you leave the operating room or when you leave the office. After your first shower, that blood that's mixed with the Aquaphor is gonna go away, and you likely won't see much more bleeding after that. About day 2 to 3, around your eyes and around your mouth, where we tend to go a lot deeper, you're going to start getting an exudate, which is like a white creamy appearance on there. You want to sort of clean that off. You can use it with gauzes. You can use it when you're in the shower. You can use any gentle cleanser that you have. So an Obagi cleanser. This is an Elta MD foaming cleanser, and our go-to favorite is really just Cetaphil that you can get at the grocery store. You can also use baby shampoo. So you can use a gauze and you can use a cleanser in the shower to wipe stuff off, but all that white goopy stuff that's starting to accumulate or something that's starting to dry, you don't want to let that happen. You want it to come off don't go pulling off strong enough to make things bleed. But this dermal wound cleanser is like, if you're just needing to get some of that schmutzy off your face, you can use this like Wound Windex. Now, when your skin has reached the point that it looks a lot more like red sunburn skin, you get out of the shower, you dry everything off, and it's no longer weeping and there's no goo on the surface, you want to go to Medical Barrier Cream. Medical Barrier Cream is an awesome moisturizer. You can even start using it before your laser, but definitely not the day of your surgery, because it creates a really nice barrier on your skin. But it doesn't have fragrances, and it helps you just reestablish that lipid barrier to your skin. Now, more long term, once your skin is healed up, the first thing we want you to go to is your sun protection. This All Calm is probably every laser patient's favorite product. It is a very heavy sunscreen with almost like a spackly foundation to it that is not a pretty color at all, if you see it here, but it covers up red like you wouldn't believe. It also has a natural anti-inflammatory in it to help with your healing. During your healing phase, I also think it's a great idea to get on excellent skincare that's going to improve your results. And my favorite is the NeoCutis line, because it does have a fetal growth factor in it. So the Bio Cream Riche is great. Also for a sunscreen, the Journée is really wonderful. And then we even have Bio Serum, which is a stronger concentration, and the Lumiere Eye Cream. So these are all things more long-term after you've healed. Remember that once your skin is healed and you're back on your sunscreen, within a week or two after that time, we want you back on hydroquinone, and eventually we want you back on your retinoid. What you might notice is a retinoid that you were able to use before surgery without irritation may be a little too strong for you afterwards, and you might need to back off a little bit on strength for a little while. Now, hopefully this was helpful to go through everything that you need. Remember to watch this before your procedure, and you can watch it multiple times after your procedure. The only medication that's really important with a laser like this is your Valtrex. Some people may also use acyclovir as a substitution. And what that does is that helps prevent cold sores. And most of us do carry, even if we've never had a cold sore, carry the virus. So for the average person that doesn't really remember ever having a cold sore, start your Valtrex the night before your procedure, and you want to continue it until your skin is healed. For those of you that do experience cold sores, you can start your Valtrex a couple of days before the procedure, and again, continue it until it's cleared. Until your skin has healed. If you think you are breaking out during the healing phase, you can take 3 of those Valtrex a day, and please contact the office so that we can be in touch with you. Good luck healing. It is hard going through a laser, but it's worth it in the long run because your skin can look so much more beautiful. Thanks.